Hi, my name is Liv Swanger and I'm the pharmacist here. Are you here to pick up a medication?
I am.
All right, can I get your name and date of birth?
Yeah, Liv. So my name is Lisa Wood. That's Wood, and my date of birth is November 11th of 1977.
Okay, and do you have any allergies that I need to be aware of?
I think I told you that this before, but I'm allergic to aspirin. Whenever I take it, I get a little bit of a rash.
Okay, perfect. We do have that noted, so thank you.
Mhm.
And it looks like you are picking up a prescription today for hydrocodone with acetaminophen. Are you familiar with this medication?
I My doctor said it's some sort of pain medication, but other than that, I'm not too familiar.
Sure. Okay, so yes, this is a pain medication and is what we call an opioid. And I did notice that this prescription, he did prescribe you 180 of them, which is typically more than we see. And there's actually higher risk of overdoses with increased amounts and dosages. And so I will want to follow up with your prescriber just to make sure that this prescription is safe for you and that it's for a proper indication. Do you have some time to further discuss the medication?
Yeah, no, I'd love to talk about it a little bit more.
Okay, sure. So upon looking over your file, are you still taking clonazepam and Ambien, or it's known as Klonopin?
Yes, is that the anxiety and sleeping medication? Is that right?
Yeah, exactly. So it looks like you're taking it for insomnia, and then your Klonopin or clonazepam is for your anxiety. So there's actually some interactions with these medications. They're what we call CNS depressants or central nervous system depressants. And whenever you have multiple stacks of these medications, they can lead to respiratory depression or slowing of breathing, which obviously we know is not good. Um, and additionally, I noticed that you have COPD. Is that correct?
Yep, I
Okay.
still need to use my inhalers for that.
Okay, sure. So opioids can actually are actually kind of worrisome when taken with someone with COPD just because of the respiratory depression. And then I noticed you also have a diagnosis of depression, and opioids have evidence to show that it also doesn't help your depression. So I just want to make sure that this is the right medication for you, and make sure we keep you safe as far as taking these medications. And so, with an opioid overdose, some of the things that we can see with opioid overdose is slowed or absent breathing, being unresponsive or not being able to wake a person up, or blueness or what we call cyanosis in fingers or on the lips. And this is a medical emergency, but there is a reversal agent. It's called naloxone. Have you heard of it?
I think I've heard the name before, but I'm not really familiar with what it does or when I really need to use it.
Okay, so for those who are taking high levels of opioids, this is a reversal agent, and how you use it is you put it in the nostril, and for someone who is overdosing, you lay them on their back, you put this in the nostril, and then you press forward. There's no need to prime it. It's a kind of a one and done, one dose. And then if the person doesn't respond within 2 minutes, you'll want to get another one with another dose and then put it in the other nostril and do the same thing. And then you'll want to move them over on their side in what we call recovery position, just to make sure that if they aspirate, it doesn't go back into the throat.
What do you mean by aspirate? Sorry.
Oh, no, that's a good question. So aspirate is when someone vomits, and then that vomit then goes back in their throat, which can then obstruct breathing.
Okay,
Does that make
that makes
sense?
sense.
Perfect. Um, and then another thing that we want to make sure to do is prevention. They say a pound of prevention is worth 20 pounds of treatment or something similar to that. And so for prevention, I did notice that you drink alcohol. Is that still the case?
That is.
Okay. So, well, if possible, we just want to avoid drinking alcohol while on opioids. And then also, do we have pets and children in the home?
Hmm. I do.
Okay, so we'll just want to make sure um, to keep this away from pets and children. So maybe in high places or behind locked doors or in a controlled area. And then also you'll want to use this medication really only when you need it for your pain relief. And if you feel like you're starting to need more, just keep in good contact with your prescriber or myself if you have any questions. Did that all make sense?
Yeah, yeah, no, that does make sense for sure.
Okay, and do you have any questions?
I don't think so. I think it makes sense how to use it and when to use it. So
Okay, sure. And if you do ever see someone, it doesn't hurt to keep this on you in case you ever need it. And then if you yourself overdose, it's always important for your loved one or roommate or whoever's with you to call 911. It's just important to make sure that we don't think that naloxone is a replacement for medical care because it is a medical emergency. So I will call the provider about your Norco script and then we can get you fixed up.
okay, I did think of one question
Sure.
for you. So when do you call 911? Is that after I've given the 2 doses or at the beginning or when would you recommend doing that?
So I would definitely give the naloxone, or they call it Narcan. I would give the Narcan and then wait 2 minutes. And if the person hasn't responded, call 911.
Okay.
Um, so sometimes these are easily reversible, but even still, you're going to want to get checked out, even if you don't go directly to the hospital.
Okay. That makes sense. Thanks for
Yeah. And Narcan does have about an hour half life. So you just want to make sure that you continually watch the person.
okay. That's really good to know. Thank you
All
for
right.
that.
Sounds good. And if you have any questions, just give us a call at the pharmacy.
Okay, will do. Thanks.
Uh-huh.